How many of you would like to be healthier than you currently are? Okay, great. How many of you would like to, when you're 80 or 90 or 100 years old, be healthy, functional, vibrant, independent, and appreciated? Okay? And then finally, for those of you that are under care with me, how many of you would like to get the best results possible from your chiropractic care? Okay, great. Well, you're in the right place. That's what we're going to talk about tonight. Tonight's workshop is my orientation part 2 workshop, which is the movement and stretching class. Orientation part 1, if you haven't done that, the posture workshop, that's coming up Wednesday, first Wednesday of September. So be sure if you haven't booked in, you want to do that one as well. And tonight, what we're going to cover are a few things. First up, I need to go through my 3 golden rules of health with you. And essentially, that is, what is health, where does it come from, and how do you get your health back and keep it? All right? These 3 golden rules, I have the sad feeling that you've never been taught this stuff before. And my understanding, from what I see and experience through all the wonderful people I get to work with, is that they don't really know what health is or where it comes from or what they need to do to get it. So, over my 25 years in my career, I've come up with some rules that explain this to you very easily. I think some of you will have an epiphany around this. At least that's what I'm hoping. So we're going to talk about that. We are going to then talk about movement as a necessary nutrient for optimal health. So I'm curious, how many of you think that we as a society should be moving and exercising more than we do as individuals? Okay, I'm going to explain what the problem with that is and what we need to do about it. Okay, and then finally, we're going to talk about how movement affects your brain, affects your health, improves things like your immune system function, prevents your spine from fusing together. All these wonderful things that movement helps us do. I want to give you a bit better understanding of that. And in that first half of the workshop, it's understanding and creating better beliefs about health and giving you a bigger reason why to change some of your habits and your behaviors. Because right now, most people in this room do not move enough. And I want to help motivate you to do that. And then, the second half, what we're going to do is get into the actual nuts and bolts of movement. And I want to give you a really easy, concise program that you can do in the morning, and it should only take you 7 minutes to move all the major joints in your body. Why? Because it's good for you. It's essential. Okay? Sound good? Well, without further ado, let's do workshop number 2. So let's talk about health and what it is. Everybody here agree that they'd like to be healthier than they currently are. What is it? What's health? Does anybody want to take a stab at defining health?
Your body running efficiently.
Okay. Pretty close.
Running at your optimal level.
Okay. Optimum. We're hearing optimum. We're hearing efficiency. Those are good words. Let me tell you a story to help get you on the, you're on the right path, but I want to make this really, really clear. I had this fellow come visit me a few months ago. He was referred from another patient of mine. He was referred from Mick. And Mick is a truck driver, and one of his truck driving colleagues had some back pain, so Mick referred him here. And this fellow's name was Phil. And Phil came in, and just so you can get an idea about Phil, he was, at the time, 59, and obese, smoked a pack and a half or to 2 packs of cigarettes a day. We also found out that his nutrition was not exactly ideal. Most of the food he ate was from the petrol station or from a truck stop. Okay, no real exercise to speak of. He'd already had open heart surgery and had a quadruple bypass. He was on 6 different medications. Got all this out of his history. And as I'm talking with him, he's describing his lower back pain. And after he's done saying that, in the exact same breath, he says, "Yeah, mate, except for me back, I'm the healthiest bloke you know." What? So I said to him, well, do healthy people have open heart surgery? Do healthy people take medication? You know, and doing this in a kind and loving way, but I'm bringing this to his attention, and you could see, oh, yeah, maybe I'm not so healthy. Okay? So he was basing his health on this, on how he what's the word? Feels. All right? How many of us in this room have ever based their health on how they feel? And this is where every hand goes up. Because this is what we've been taught. Okay? When we're children, we get taught that if we feel bad, where do we go? Doctor. We get either 2 options, pills or surgery. And then when the pain or the perceived problem goes away, then we go away. Okay? We're taught that if we feel okay, then everything must be okay. But this isn't true. And this is literally killing people. Because we have this understanding that if we feel okay, then everything is okay. Let me illuminate this for you right now. True or true? You can have a tumor, you can have cancer, and not feel it. True or true? Okay. You're not unhealthy the minute you get a diagnosis, are you? Because you can have a tumor, depending on the type of cancer, for months or years before you start getting symptoms. Okay? Symptoms are not the problem. Symptoms are just the eventual warning sign of a problem. And what I've learned is that symptoms are often the last thing to show up, and they're usually the very first thing to go away. Okay? Ambulance drivers that I know, they say that about 50% of the time, the first symptom of a heart attack is death. Too late. Too late to quit smoking, get exercise, change your diet. Because those are the things that cause heart disease. Okay? This is the most important thing I can teach you. This one thing, if you walk away from here with only understanding one thing, and you understand this, I've added life to your years by doing that. What you need to know what health is, what it really is, it's another F word. What's the word? Functioning. Health, optimal health equals optimal function. Mentally, physically, socially, spiritually, chemically. And if all those things are working, and if they're balanced, then you're healthy. You're the very best version of you that you can be. Okay? Chiropractic's goal is to help you be optimally healthy. And if we're building a house, no, I'm not an architect. Okay? If we're building a house, we need to have a level foundation. And I like to think of your almost level foundation here, Dave, is your nervous system. Well, why your nervous system? What does your nervous system control? Everything or everything? Everything. Good answer, Chase. Clever boy. Nervous system controls everything. And that's where chiropractic impacts your health. Okay? Chiropractic is not about fixing back pain and neck pain. It can do that. But does it make sense that if we get you functioning at 100%, then you're going to be feeling a lot better most of the time, if not all the time? Okay. Am I splitting hairs? Yeah. But I need this to be crystal clear. Because if you're coming to your chiropractor just based on how you feel, you will be disappointed. If If you understand that it's about function and the other benefits, and I'm going to talk about some of those tonight, you understand that, you're going to understand why you want a chiropractor for the rest of your life. Okay? All right, turn to the person next to you and say, optimal function equals optimal health. Do it right now, folks. So that's golden rule number 1. Health is optimal function. Where does it come from? Let me tell you another story. About 10 years ago, summer holidays, we went down to Jindabyne, to the snowy mountains. I like going down there because there's some good trout fishing. And I make my family go where I want to go on my 2 weeks off a year that I take. And we were camping at a caravan park near Jindabyne. It was our last day. And my daughter and I woke up early. Stella was about 5. And we're the early risers. Clayton and Kylie, they sleep in. Stella and I got up early. We went across the road to the playground. And they had monkey bars and swings and that kind of stuff. And we went across the road to do our morning stretches. The exact same little program that I'm going to do with you tonight. We're going to do that and then have some breakfast and maybe go look at some kangaroos. So we're going across the street and I'm walking along like this, like I do. And Stella's behind me and the playground's over here. And I'm minding my own business and she goes, Dad, watch. And so I turn around like this. And what she's done is she's gotten up on the bottom rung of the monkey bars. And there's a rung and then another rung. And she'd been practicing jumping to get the second one. Okay? So up she jumps, you know, slow motion. And I can see her get the hands on the monkey bars. I'm like looking like this. And I see her little feet go this way, and then I see her hands slip because it's morning and there's dew, and I see her come down like this, and in slow motion I'm going, oh, shoot. And she lands. And immediately, oh, my arm really hurts. Let me look at it, and it's like, oh. So we do the old shirt thing, pick her up, I feel sick, you know. And we go over and I'm kicking on the tent, get up, we gotta go. No, we have to go. In that tone. Long story short, that's the end of the camping trip. Come back to Newcastle, I'm speaking on the phone with a surgeon to get her into theater for the next day so they can x-ray her and everything else. We stopped in Kuma to get some painkillers and a little bit of a splint, you know, which I'm really grateful for. Next day, she's in theater, they knock her out, plaster. That's the end of swimming for the summer for Stella, no more pool for her. But if you look at her now, and if you were to x-ray both arms, you'd never know that she broke both of the bones in her forearm. Pretty cool, isn't it? Okay, so here's my question to you. Now, who did Stella's healing? Stella did Stella's healing. Everybody, I think, understands that the painkillers didn't heal anything. The plaster cast didn't heal anything. The surgeon didn't heal anything. Now, let me set the record straight. I'm grateful for the surgeon and the plaster and the painkillers because they helped. Absolutely. Wouldn't want her to do it any other way. The thing I want to make sure is crystal clear is that Stella healed Stella. You healed you. Nobody else has ever healed you of anything other than you. Okay? Medication and surgery can help. When your house is on fire, you call the fire department to put out the fire. That's what medication and surgery do. Okay? But when it comes to healing, you heal you. And what I want to do with all my workshops is I want to teach you and show you how amazing that potential is. And you've been robbed of that understanding. All that education as a child, when you're sick, go to the doctor, get a pill, the pill fixes you. And that's what you've been taught. And that's what you carry through your whole entire life. Fast forward to when you're 80 years old and you're taking 10 different medications that aren't helping. Okay? There's something wrong with the picture. Chiropractic understands that you heal you. And I've never healed anybody. of anything. After 25 years, I've never healed anybody. Quick, somebody take my license away. Worst chiropractor ever. No, I've never healed anybody of anything. All I help you do is help your nervous system work better. By pushing on those little joints in your spine, it takes the pressure off the nerves, and that allows that signal to flow better. So health really only comes from one place. And where does it come from? Turn to the person next to you, say, health comes from within. Do it right now. And I do these funny things to keep you engaged and keep you learning. All right? So, rule number 3. We talked about what health is, where it comes from, and what you need to do to get it. Is the third one. And it's really, really simple. Most people think about their health as an expense. And they think, oh, my gym membership costs me money, or that CT scan is going to cost me money, or it all costs money, okay? And we're so stressed out and so busy, the other thing that it costs us is time and energy, and that I'm seeing is becoming even more and more important, those two commodities. But it's not an expense. And really, if you want to be healthy, you need to look at it that you need to do this. What's the word? Invest. Okay? And it's kind of like your superannuation or a real estate portfolio or stocks. If somebody invests in their financial future, they're going to have a pretty good future. But people that don't invest in their finances, when it comes time to retiring, probably not going to retire. So, if you imagine that I was a financial advisor, and some fellow came to see me who, let's say, worked in the mines the last 40 years, and he was 66 years old. I think what's retirement age? 67 now. It keeps getting a little longer and longer. But he was 66 and a half years old. He says, I'm going to be 67, I want to retire. I say, great. What are your assets? And he never bought a house. He never bought anything, only minimal amount in superannuation, but spent his money on booze and cars and trips and clothes and whatever. What am I going to tell him? Sorry, I can't help you. Okay? And this is what people are doing with their health. Why? Because they don't know what health is and they don't know where it comes from. You need those two rules to be able to do this. Okay? Investing in your health is pretty simple. There's not a lot you need to do. There's only 3 things you need to know how to do. Does anybody want to know what they are? Because that's what I'm going to tell you. It's only 3 things. And the neat thing about investing in your health, unlike your superannuation or real estate or stocks, you're guaranteed a return. You're guaranteed a dividend by investing in your health. So, the 3 things that you need to do I'm going to get you guys to guess. What are they? You know them. Innately, intuitively, you know them. What are they? You need to, well, yeah. Move well is one of them. Eat well. No, rest well is part of this one. Giddy up. Sleep is just a different way of thinking. Really, is what it is. Okay? So think well, eat well, and move well. And that's what you need to do. Okay? So, turn to the person next to you and say, think well, eat well, move well. Do it right now. Okay, so let's talk more about moving well, because that's what tonight is about. I've developed a whole 3-day seminar on Think, Eat, and Move Well, and the things that you really, really need to do. Hopefully I can get to that again sometime later in the year, so I'll let you know if I do, for those people that are interested. And it's the top 17 things that you need to do in order to live to be 100 and still be healthy. But let's talk about moving. And I've studied under a fellow, this guy right here, another Canadian, crazy Canadian guy by the name of Dr. James Chestnut. He's probably the leading expert in the world right now on what we call wellness physiology. And I've done his certification program through the International Chiropractic Association. And he's written a number of books, and this one is for lay people or consumers, patients to read. And he has very cleverly figured out what it takes for people to be healthy. And he does something that we call model behavior. And what that means is we look at successful people and we do the same things that they do, and we should be successful in the same thing. And talking about health, he's found a group of individual people, a few different groups of individuals around the planet that are still really healthy. So when we're talking about health, I'm talking about lifestyle illnesses, cancer, heart disease, diabetes, and obesity. And how do we reduce or eliminate the risk of getting those 4 things? And what he's found is that there are some pockets, some populations of people that know how to do this really well. And these are people that are essentially still, in this modern world, hunter-gatherers. They live wild. They hunt animals and they gather stuff off of plants and out of the ground. They don't raise crops. They don't domesticate animals. That's the big difference. And these people just don't get any of these illnesses. Okay? So his movement model is based on what those people do historically. So let's do a little bit of brainstorming and let's talk about movement. Okay. What these people do. You guys tell me? Number 1 answer. Okay, wasn't it? Do you watch Family Feud? Do you watch that? That's the number 1 answer. I'm a little bit taller than Grant Denier though. So that's the number 1 answer. Let's talk about it. And what 30 minutes a day of walking will get you in terms of improved health. So Chestnut's gone through all the research, and here's what he knows. Prevent 91% of cases of obesity and type 2 diabetes. Prevent 50% of all cases of heart disease. Prevent 50% of all stroke deaths. Normalize blood pressure. Reduce developing high blood pressure. Reduce and maintain normal cholesterol levels. Reduce risk of breast cancer by 60%. Reduce risk of pancreatic cancer in overweight people by 50%. Reduce lung cancer even in smokers by 72%. Reduce melanoma, that's right, skin cancer, apparently from the sun, by over 72%. Prevent 50% of colon cancer, reduce the risk of developing rheumatoid and arthritis and osteoarthritis, improve bowel function, decrease cause of mortality. I'm skipping a bunch of these. All causes of mortality by 60%, prevent up to 40% of cognitive impairments, prevent up to 62% of all cases of Alzheimer's, and 52% of dementia. Okay? And it goes on and on and on. In kids, enhanced learning by 12 times, decreased depression by 20%, including relapses, on and on and on and on. And that's only 30 minutes a day. Our ancient ancestors walked, on average, 20 kilometers a day. All right, so that's 20,000 steps, roughly. All right. What else did our ancient ancestors do for movement? Yeah, there we go. Yeah. If you've ever hunted hunted, you know that you've got to pack that animal out of there, you've got to cut it up, you've got to skin it. Like, it's a lot of hard work. Gathering, that's a lot of bending, crouching, and reaching. Okay? What else would we do? Well, I'll give you a hint. These people moved around, so they'd have to build shelter. They would move around. Okay? What else?
They were Jews.
I was going to get to that eventually. So, at the end of a big day, probably build one of those. That requires a fair bit of work. Okay? If you've ever to make a fire, it's pretty hard. I've never been successful. All right. After you had a feed, you probably did a bit of this. That seems consistent with all hunter-gatherer tribes. Then, as Dylan so Dara quickly put it, our great exercise. Get your heart rate up and get most of the major joints moving. Okay? So, what do we do for most people as a society? Okay, we're gonna sleep it all night, then we go have some breakfast, get some rice bubbles down our throat, get in the car, drive to work, sit at a computer most of the day, drive home, have some tea, watch some telly, and go to bed. That's a lot of people these days. Okay? And it's killing us. 30 minutes a day will change it. Let me show you what this does to you. This part is about changing your core beliefs. Some of you still think that movement is just a good idea. It's something you need to do. If you really want to live a good life, you need to move more. All right, so what I have drawn here, this is a brain. This is a part of your brain called your cerebellum. This is the spinal cord. This right here is a joint. It can be your elbow, it can be your knee, or it can be one of the little pairs of joints that are in your spine. Okay? Now, coming off of every joint in your body are a couple of sensors. Okay? That go to different parts of your brain. And if you can imagine a switch, like a toggle switch or a slidey switch, the switch connects one circuit or the other. Only one can be on at a time. And the blue one is for movement, and we'll call that one, the red one, P for pain. Now this is a little bit simplified, but this is how you work. So if I'm moving, the switch slides down here, and these joints send movement signal to my brain. What you need to know, long story short, movement signals makes my brain happy. Okay? And that movement signal goes up through my cerebellum, through my thalamus, to all these different parts of my brain that affect memory, creativity, cognition, affect my mood and my emotions, and also affect hormone levels in my body, certain hormones. So when I get movement signal, I get happy hormones released, things like serotonin. All right? When I'm not moving, guess which way the switch goes? And what circuit is connected? P for pain. That signal goes up to my brain and it goes to all those same different parts. Now watch this. It's not always pain that you feel. Okay? That signal can be connected, but you don't necessarily feel joint pain. But it might make you grumpy and irritable and depressed. It might affect your memory and your concentration. It might affect your ability to think clearly, all right? And will most certainly affect hormones in your body. And the one that I'm most concerned about that's a kidney, and that's your adrenals. And when you're getting pain signals, it tells your adrenals to increase a hormone called cortisol. Who's heard of cortisol? Who knows what cortisol does?
Stress hormone.
It's your primary stress hormone. That's right, Robin. Along with adrenaline, stress is your primary, cortisol is your primary stress hormone. Do you know what cortisol's main job is when you're stressed out?
To take it away from what's stressing you out.
That's adrenaline. What cortisol does is it suppresses your immune system.
And that's where diabetes, all that sort of stuff comes in, is that right?
That's a bit more complex, okay? Let's talk about it in a big global perspective. High cortisol suppresses your immune system. When your immune system is suppressed, you have a higher likelihood of infection, okay? But you're also more likely to get, run out of space, that. Who here remembers me mentioning exercise lowers prostate, pancreatic, bowel, lung, melanoma, and colon cancer? Okay, here's why. If you're not moving enough, cortisol levels go up, and so do those two things. So what do? Take antibiotics and chemotherapy agents preventatively so we don't get this? Or do we increase our movement? What's the easier, cheaper one? All right? So, movement. What happens, do you think, to cortisol? As movement goes up, what goes to cortisol?
Down.
Down or down? Good answer. Okay. What happens to your risk of infection?
Yeah.
What happens to your risk of cancer? The research shows this. Okay. Diabetes, heart disease, and obesity are all different mechanisms. They don't necessarily work on cortisol. That's just one aspect that I wanted to show you. Okay? Here's where the light bulb should go on. When you see your chiropractor, what is your chiropractor doing to the joints in your spine?
Realigning.
By moving. We're creating movement in 26 pairs of joints. Okay, who here is after an adjustment noted they feel a little bit elated or happy? Like immediately after an adjustment? Me too. Okay? It happens. Alright? Rose-colored glasses, bit euphoric, sun's a little bit brighter, the birds are singing a little bit nicer. Well, movement signals going to your brain affects your emotions. Okay? So if you come to a chiropractor just for pain relief, well, you're probably going to get that, but you're not paying attention to the bigger benefits of what these adjustments are doing. When you come to Posture Workshop, we're going to talk about how it helps protect you against dementia and crippling arthritis in your spine. Okay? Who here feels a little bit more motivated to move a bit more?